Welcome to HMS, let the power flow. Feel the rhythm in your veins. Every rapid nitro flame.
All right, so our third section we're looking at in management of prevention of sports injuries is looking at how we actually manage injuries. Okay, what do you do if someone's injured? Okay, we've already gone through the toe taps procedure. We know what injury we're dealing with, so now let's deal with it. Okay. First of all, if it's a hard tissue injury, okay, so we're talking like fractures, dislocations and stuff, or anything that's life-threatening, all you can do as a first aider or a coach or whoever you happen to be is you will mobilize the site, so you stop them from moving it, okay, and you can do that via a sling or a red bandage with support. So imagine if you don't have a sling, but you've got a bandage and you've got a stick, well, put the stick up against their leg and then bandage it to their leg, and now they can't bend their leg because they've got a stick holding it in place, right? So immobilizing, we're going to apply ice if it doesn't cause them pain. We're not going to try and make anything worse, okay? So, but ideally, if you can have some ice on it, it would help start reduce a little bit of inflammation around for the soft tissue stuff that's going on as well as the hard tissue stuff. And then we're just calling 000. If obviously it is a compound fracture or something that's really bad, we're going to call 000. If they're not in too much pain and they're not bleeding and they're not, going to go in shock or wherever, then we can probably just refer them to hospital or take them to hospital ourselves. So that's what we're doing for hard tissue. Now let's look at soft tissue. So imagine these are things like, you've got tears, strains, sprains, all that kind of stuff, all right? We used to, before I go on. The process of a soft tissue injury healing, from injury to healing, it goes through three phases. So the inflammation phase or the inflammatory response phase, that's basically where your body just detects there's an injury and it sends a whole bunch of stuff to the injury to try and, one, stop you moving it so it doesn't cause further injury, and two, it's sending stuff to help fix it. The second phase is proliferation, so that continues on and now we're repairing. And then our third phase is our remodeling phase to get the soft tissue back to the way it should be working. And we need to be doing some physical activity to make the remodeling effective, okay? So we're lining up the fibers the right way. Now we used to use the RICE protocol, rest, ice, compression, elevation, referral, but they've replaced it with the police protocol, all right? And the idea of replacing the RICE protocol with the police protocol was that rest, ice, compression, elevation, referral didn't really say anything about how you're actually going to be doing physical activity to recover faster, okay? But police basically incorporates all of this stuff, but also encourages movement, obviously under the guidance of your doctor or your physio, to get the proliferation and remodeling phases done sooner. So police, we've got P, protect. We're going to protect the injured site via a sling, bandage, if it's a cut, gauze, something to protect it, all right? So stop you moving it, stop you causing more injury, etc. Then we've got optimal loading, okay? So gentle exercise, obviously mainly going to be done under the guidance of a physiotherapist or someone on staff to promote blood flow and recovery and minimize atrophy. So remember we talked about hypertrophy is the building of muscle, or atrophy is the loss of muscle when you don't use it, okay? Remember, use it or lose it. And we don't want this to happen, especially as athletes. So we want to try and maintain everything we've got while we get better. So we've got the ice phase. So ice is via, doing cryotherapy stuff, ice baths, or just ice in general, straight on the site. Causes vasoconstriction, which reduces inflammation and pain. Compression and elevation all do the same stuff as ice. Compression specifically, though, can control inflammation by reducing the physical space for swelling, okay? So if I've got an injury here and I wrap it in a tight bandage, well, it can't really swell up that much because it's compressed, okay? And then elevation. So elevating our injured site above the heart as best we can to reduce inflammation. So it makes it harder, like against gravity, makes it harder for the body to send stuff there, but also encourages drainage of waste products and all the bad stuff. So remember, when you send, the body's trying to send good things there and take bad things away, and this will encourage taking bad things away if the injury was on my arm. But obviously I'm not going to stand up like this all day. I'd be probably lying in a bed and I'd have my arm, elevated with a cuff sling or something like that. Just briefly to finish off looking at management of injuries, I feel like we should address skin injuries because you're not going to apply the police situation to like a cut. All right. So the better way, so a cut, laceration is the technical word for a cut. The best way to do this is with the PER, okay? Pressure, elevation, and rest, okay? Yes, there's lots of acronyms you need to remember, but you know, kids that want to do well will remember them. So pressure to laceration and applying compression, it helps stem bleeding and also encourages clotting, okay? This is time tested. You watch any movies from like, you know, World War I and stuff, and they're like, put pressure on the wound. Yeah, well, guess what? Here we are 100 years later and it's still pressure on the wound. 110 years later, ooh. Anyway, yeah. Elevation, so same reason we're elevating for our like sprains and tears and stuff, you're gonna elevate above the heart to reduce bleeding, okay? Blood flow is slower when things are elevated above the heart because of gravity, etc. And then rest, you're simply just gonna rest the wounded site until the wound heals or closes over, depending on what type of cut you're looking at, okay? Obviously, if it's just a scratch or whatever, you know, do this immediately and then probably you're right to go the next day, all right? Something more significant, you may need to be referred for stitches, etc. But stitches is simply just going to close up the wound and then you're just going to rest until you're cleared to go again. But that'll finish off our third section looking at management of injuries. Thanks. All right, so in our fourth section looking at the management and prevention of sports injuries today, we are looking at the rehabilitation of sports injuries, okay? So now you've got an athlete who has been injured. How do we get them from injured status to returning to play, okay, back on the field? So there are 3 phases to this, and I'm gonna go through each phase, and within each phase, I will embed the last point, which is like the use of heat and cold. So instead of teaching it separately, we'll show you how it should be used at each phase. So our first phase for rehabilitation is what we call progressive mobilization, okay? So imagine you've been injured, and in this video, I'm actually going to use my Achilles tendon tear that I had a couple of years ago and give you examples of what I did at each phase to demonstrate this, okay? So progressive mobilization is gradually increasing the active and passive range of motion as soon as possible post-injury. Now, when I say as soon as possible post-injury, you've got to be pain-free, as in like, doing the exercise with your physio or whoever is telling you to do the exercise, it doesn't cause you excruciating pain, okay? So, for example, with my Achilles tendon, I was in a cast, okay? I was in a cast for, I think, about 6 weeks. And then after 6 weeks, when the cast came off, then I started progressive mobilization, right? We weren't doing this stuff, you know, the day or the week after the injury, okay? It's up to the doctors and the staff as to when they think that there is enough healing that has gone on to get to actually the first step to rehabilitation, all right? So what I'm saying is it's not immediate, but it's got to be as soon as possible, okay? So progressive mobilization is done with gentle movements introduced early to prevent the development of scar tissue, okay, which is hard and inflexible tissue. So if you tear a muscle and it doesn't repair well because the inflammatory response has sent too many materials to that site, instead of it repairing as a nice, you know, elastic, pliable muscle or connective tissue, it can become hard and very hard, all right, like a scar. And that happens inside your body as well, on the outside where your skin is. And so therefore, if you have minimal scar tissue, it allows a faster return to the full range of motion, pain-free, okay? So for example, if you injured yourself and you didn't do any rehabilitation, you didn't see a physio, you didn't do any exercise or anything, you could be stuck with that injury for the rest of your life, okay? So if I didn't do stuff with my Achilles tendon, I might be walking around, you know, like this for the rest of my life. And you see people who have injury, who have clearly had an injury in the past and they didn't rehab it right, and that's just how they are now. So we don't want that. We want to be back to our normal performing selves. So when we're doing progressive mobilization, heat should be used pre-movements to increase vasodilation and pliability of the muscles, okay? Can also reduce pain or your pain receptors because it feels good. And then we should be using cold post-movements to reduce any inflammatory response which may be triggered from the progressive mobilization. Because remember, we're not healed. We are broken at the moment, and any movements we do, the body may still detect, well, it will detect that there's still a problem, so it may trigger a slight inflammatory response after these training sessions. So you should be applying cold to minimize this, so therefore we're going to minimize scar tissue. So for example, with my Achilles tear, basically I would apply some heat or just give it a rub, or the physio would manually manipulate the area to heat it up. And then we very simply, for the first phase, we just did ankle circles, okay? So I would go to the physio and have my leg out, and he'd be like, okay, need you to do 20 ankle circles in one direction, like this. And you can imagine after my Achilles injury, ankle circles weren't very good range of motion. So the cue was obviously to make as big a circles as possible, but you know, they were tiny and they were tender, and the movements weren't quite circular. It was more like a jerky square. But 20 one way, 20 the other way, that was it. That was literally 2 weeks of rehab right there, just doing that a couple of times every day. But I'd also do it on my other foot, just to make sure that the body, because the body and the nervous system doesn't forget how things move, okay? And you can see how, well, the physio could basically use that to show one side to the other, because he would look at my right side and be like, okay, this is what the left side should be like. And so we knew that when the left side was like the right side, that the progressive mobilization phase was probably finished, and we needed to move to the next phase of rehab. So our second phase is looking at our graduated exercise. So this is probably the largest phase of rehabilitation. It can take athletes quite a long time to get from their injured status to being confident enough to go to the next phase, which is actually returning to training, not returning to play, returning to training, proper training. So graduated exercise is gradually increasing the intensity, duration, and the load of physical exercise. So progressive overload via flexibility training, strength training, and endurance training helps align new collagen fibers correctly, and it reverses atrophy from the initial rest phase. So remember, when you don't do something, you lose it, so reversibility happens, okay? So what we're trying to do now is reverse the reversibility and just get back to a standard state. We're not trying to improve anything. We're just trying to get our injured status back to normal status. And like I said, this can take months. So with my Achilles, for example, this phase for me lasted about 7 months, okay? Which is a long time. It's a long time to be rehabbing, and, you know, especially as an athlete, when you're, well, I'm not an athlete, but I'm saying as an athlete whose livelihood depends on it, you can imagine like the head games, because even I was starting to go like, oh, is this ever gonna get better? Is this ever gonna get better? Because you're sort of just doing the same thing day in and day out for weeks on end, and then you get a new program and you do that for weeks on end, and then, you get there in the end. So with flexibility, what we're really looking at here is we're going to progress from, a static stretching to PNF stretching. So remember, PNF is using someone else to force a load against, to then doing some dynamic stretching, all right? With strength, we're looking at progressing from isometrics, so remember holding a load without movement at the joint, to then isotonics, which is movement at the joint loading. And with endurance training, we're looking at progressing from aerobic work, which doesn't use the injured site, to aerobic work that does use the injured site, okay? And then finally, once we've gone through flexibility, strength, and endurance, we can start to introduce some skill-related components of fitness training, okay? So like agility training, balance training, coordination training, right? It's all important to rebuild proprioception and stability in the athlete before they can actually go to training, okay? Same as before, we're going to be using heat pre-session, and we're going to be using cold post-session. However, because you're now doing more than just some slight progressive mobilization stuff, there may be more inflammation. So with your cold regime, you may need to cycle it on 20 on as in like 20 minutes, applying cold for every hour, until, for maybe like 2 or 3 sessions straight after training, and then the pain goes away, okay? So it's not just a one and done thing now. So for example, with my Achilles, I remember doing some PNF stretching with the physio, and we did some stretching under load. So as in like, I would go into like a calf raise situation and put my toes into a slight dorsiflexion, but not like full dorsiflexion, like my Achilles wasn't there yet. But I wouldn't actually be like doing the calf raise motion straight away. I'd just be like, it's pretty much like an isometric, but a little bit of a stretch too, okay? We did greater dynamic circles. So the physio really wanted to see me, expanding my flexibility at my joint by doing greater circles every time. Then we progressed to some calf raises, and calf raises at the very start were just on a flat ground, body weight, okay? There was no weight at all, and I wasn't even going full range of motion, because standing on flat ground isn't full range of motion. It's when your ankles are in dorsiflexion. That would be, so going from dorsiflexion all the way up to plantar flexion, that would be full range of motion of the ankle, and we weren't doing that, okay? We were just doing sort of half of the range of motion to start with, and then we progressed. We did do some stationary bike, but we had the seat positioned in a situation where my feet were locked in, so it was like a recumbent bike like this, and as I moved the pedal around, there wasn't actually much movement at the ankle itself, okay? But then we progressed from the bike to the treadmill, and then the treadmill on an incline, and then we also progressed from walking on the treadmill to running on the treadmill. So you can see that these things are slow, and if you sort of just, if you get a question on this in the HSC, just take a minute and think about how could you progress this to go from easy to, not hard, but easy to more challenging, all right? And then we finally, as far as the skill-related stuff, once I was able to walk around, I still needed a boot some of the time. Then we started to introduce some jumping and landing things. So I would like start off with two foot springs like this, and then we progressed to 1 foot spring hops. Oh, I've just gone off screen. That's fine. 1-footed spring hops, and then I'd jump up onto boxes and jump landing from the boxes. Okay, so all of that stuff you could definitely see at the very start of my injury wasn't going to happen, but we got there. So that is the longest phase of our recovery, or rehab I should say, and then we'll go to the last one. Okay, so our third phase of rehabilitation of sporting injuries is training itself, okay? So now we're returning to training. So whether you're an individual athlete or whether you are a team athlete, you go to training now with either your coach or your team, okay? However, when we are reintroducing training, so first day back at training, you're not going to go and do what everyone else is doing, or if you're a solo athlete, you're not going to go and do exactly what you used to do pre-injury, okay? Training is going to be modified to cater for your ability, because remember, reversibility has definitely happened. There'll still be a lot of psychological noise in your head about whether you're going to get re-injured or not, so you need to build up your confidence. These things take time, okay? People get injured in sports. You don't just shrug it off. It takes time. So for example, let's talk about any team sport player. Let's go like a rugby player. Individualized fitness and strength training versus what the rest of the team are doing. Okay, so if a rugby player went to training and the focus of training that day was aerobic work and the whole team was doing, like suicide sprints and burpees and laps around the oval and stuff, well, the injured athlete may just be sitting on a bike, still doing aerobic work for the same amount of time maybe, but not at the intensity that the rest of the team are doing, and not with the change of direction and all that kind of stuff, which may have, especially if you did an Achilles or something, which would be hard to get over psychologically. Small-sided non-contact drills to rebuild confidence and strategic and tactical awareness. Okay, so let's say we're our rugby player, the team are doing strategic and tactical development. They're doing 3-on-2 situations. But when it's your turn to do 3-on-2 situations, it becomes touch instead of tackle, right? Everyone else is tackling each other, you are touch, or maybe you're Oz tagging or something like that. Still the same purpose of the drill, but that, fear factor of you getting re-injured is removed from it. And maybe if the team's doing some tackling practice, instead of them, doing tackling practice and, wrestling and grappling with each other, you're just tackling on the pads. So you're still doing the same stuff, it's just modified until you get to the point where you are confident enough to do the same stuff. Heat may and can still be used pre-exercise for vasodilation, blood flow, elasticity, joint mobility. Okay, heat's always good pre-exercise. The only time heat is not recommended is in that immediate inflammatory response phase straight after an injury, okay? And I did put up that no harm thing in the previous video. 2 videos ago. So, but every other time heat is still good. Even now, if you guys go to the gym, there's no reason why you couldn't be applying heat to any sort of niggly spots in your body, but that is also the purpose of a warm-up that I know most teenagers don't do. So you'll regret it later when you're older, like me. Cold still has the same role in the body, but it can now also be used as our physiological recovery strategy. Remember, removing waste products and byproducts, reducing DOMs so we can train again sooner, etc., etc. So in this phase, if the whole team are doing like, hydrotherapy where they're cycling between warm water immersion and cold water immersion, you can do that too, all right? That's good for you. Well, good for recovery, and that's what you're trying to do after your training. So if we look at my Achilles injury, because I'm not a sports player and I wasn't doing any sport, well, I was doing sport at the time, but I'm not like a rugby player. So what I did for the training phase was that we just progressively overloaded everything that I was doing prior. So I was given a specific strength program to do, looking at calf exercises and glute exercises. And then my physio checked in with me every couple of weeks to make sure that I was doing some sort of progressive overload, whether it was more load, more repetitions, greater range of motion. All of those things demonstrate PO. And the other one was our treadmill running. So started off doing a certain speed on the treadmill at a certain incline for a certain duration. And then we checked in, I think I did this 2 or 3 times a week. And every time we just increase one of those variables, okay? So instead of running on a 5% incline for 10 minutes, maybe I ran for a 6% incline for 10 minutes. Or next time, instead of running on the 6% incline for 10 minutes, I ran on the 6% incline for 13 minutes. Well, I don't think the jumps are that big, I think it was like 2 minutes. Or maybe instead of running on a 5% incline for 15 minutes at 8 Ks an hour, I ran on the 5% incline for 15 minutes at 9 Ks an hour. Okay, there's so many things that we were doing, but it was all tracked, okay? Data records is important for rehab. And then finally, once we've gone through all of this, and depending on the severity of the injury and stuff, like obviously a torn Achilles is a much significant injury than like, a sprained wrist, for example. Then we can return to play. And it's important that you guys always finish your responses when you talk about this stuff to return to play, because that's the whole goal of rehabilitation. Right, that was it for our 4th part. We have 1 part left on the management and prevention of sports injuries.